Good afternoon. Thank you so much for attending this training on school employee wellness. The purpose of this second training is to discuss your school needs assessment, describe how to analyze the findings, and present the template for action planning as well as some approaches for school employee wellness. In the presentation, Erin and I will describe the data analysis, specific examples. We will describe the selection of aims and drivers as well as approaches based on your data. We will provide some phase 1 data in the school employee wellness area. We will provide some recommended approaches and policies. We will discuss the action planning template and reporting. And we will conclude by talking about next steps. So as you previously saw in the first training, our objectives for school employee wellness are by December 2015, 100% of Hallways to Health project leads will disseminate a standardized school employee wellness needs assessment created by the School-Based Health Alliance to school employees. We've completed that step. By December 2015, 50% of school employees at each site will complete a standardized employee wellness needs assessment. We've also completed that step. By mid-December 2015, School-Based Health Alliance will provide training on school-level data analysis from the School Employee Wellness Survey on the action plan template and will recommend at least 3 approaches to improve school employee wellness. This is the step we're currently at. Following this, our overall employee wellness objective is that 100% of sites will institute at least 1 school-wide policy change in the area of school employee wellness. One of these will focus on healthy eating and active living, and another will focus on social emotional health. By changing the environment to make healthier choices easier for school employees, we will ensure that the work can continue beyond Hallways to Health. The focus on policies will support healthy eating and active living for staff as well as their social emotional health, both key components to a staff that is ready to perform their job well. Much of this work will build on what you have already been doing in the area of school employee wellness during phase 1. It is essential that you complete the first 2 objectives before proceeding. Our invoice processing in January will be dependent on completion of the school employee wellness needs assessment or a written rationale of why the needs assessment didn't happen. It will also be contingent on submission of the employee wellness action plans, which are due after the reporting and due January 29th. The training objectives for this session, as we just indicated, are to understand the link between changing policy and improving health, list the steps necessary in extracting data from Survey Gizmo, understand how to quantitatively analyze survey results to identify aims, drivers, and approaches, understand how to qualitatively analyze survey results to identify aims, drivers, and approaches, become familiar with the action plan template, and identify possible approaches for your site.
So as you all know, school employee wellness was an area of great success for many of the school-based health centers that you all work in during phase 1. We encourage you to build upon what worked in phase 1 as you work to institutionalize your efforts through systems change in phase 2. This was a big area of growth for the school-based health centers participating in this project. Many SBHCs surveyed the needs of school staff and developed a series of activities for school staff based on their responses in phase 1. So we incorporated this success through the needs assessment in phase 2. Here you can see that at baseline, about 13% reported that the school had an employee wellness program, and at endpoint, 60% reported that the school had one. Also at baseline, about 0% of the school-based health centers in phase 1 reported that the SBHC had an employee wellness program. And by endpoint, 80% reported they had a wellness program. So we can see there are a lot of important steps that happen in phase 1. Here we can see that at endpoint, which are the far right lighter teal bars, there was growth and improvement in the existence of policies to support school employee wellness. Here are some of the approaches that you all tried in phase 1. In particular, there were some policy and systems changes that could be capitalized on by other SBHCs and further expanded on for Phase 2. There were some really creative approaches to improving school employee wellness at multiple levels of influence, and many of these approaches could be scaled up and institutionalized. For instance, one popular activity in the last phase was a health fair. By itself, a health fair seems like a good thing, but we're encouraging you to think about what the broader purpose of that health fair is this time around. We know that all approaches and activities should fit into a greater plan of changing health and culture in your school. So the health fair might be used as an intermediate approach to achieving their broader health outcomes and should have specific objectives tied to it. If the health fair kicks off a semester-long school fitness challenge or a semester-long educational curriculum on nutrition, that might be a useful approach. If the goal of the health fair is to increase visibility of administrative support of staff wellness and creating a supportive environment for staff to practice wellness, including healthy eating, active living, and social and emotional health, this might also be an acceptable approach. We encourage you to continue to document as you work and build off what worked in Phase 1 and what you learned from the needs assessment. This slide refers to student social and emotional health, but this message might be used for school employees as well. As the initiative progressed through Phase 1, there was a dramatic decrease in the number of programs who reported delivering individual level interventions, which are one-on-one between the provider and the patient. This was paired with an increase in the number who reported delivering group-based social and emotional health programs. In Phase 2, we're encouraging the expansion of that trend to deliver population and preventive services outside the clinic and reaching more of the school population and broader community to help impact the culture of health. The intention is that these services are preventive in nature as opposed to focusing on individual risks. When you design your action plan, keep this shift in mind. We're also available to help you with this process. Next, I'm going to talk about the case studies that many of you participated in. The case study on school employee wellness identified two main keys to success, which are useful lessons to keep in mind when considering your action planning for Phase 2. As you all know, engaging partners is critical. You've successfully implemented the needs assessment in partnership with school administrators and employees. Assessing their interests for SBHCs in the past ensured that approaches met their needs, increased participation rates, and improved sustainability. Attending faculty meetings, taking time to chat with employees, and other things will also help to build relationships. Another lesson learned was to remain open to new ways of program planning and implementation and not be dismayed if things might not go according to your original plan. For example, one school-based health center has an in-kind donation that sponsors massages for teachers. Utilizing staff or PTA members to provide services could be a cost-effective approach as well. So we know that utilizing low-cost and creative strategies will help to improve staff wellness. Some employee wellness programs in Phase 1 didn't require significant money or resources. There are other ideas from Phase 1 like health tips via email and starting physical activity competitions. And these might be sustainable if they require a few resources in terms of money or staff time.
Thank you so much, Erin. Those are really great examples from Phase 1. And as we begin our Phase 2 school employee wellness work, and your sites were asked to complete the school employee wellness needs assessment, and you use many of those tools from Phase 1 to be able to complete that. So since we're not live, I just want to be able to share some really great takeaways from the administration and implementation of the school employee needs assessment. And this really exhibits the fact that you know your sites best and what works for you, what works for your teachers, and have made the necessary adjustments as well as built the relationships needed to be able to do some of the school employee wellness work. So some of our sites have, none of our sites have 0% completion, so congratulations. and many of our sites have 50 to 100% completion by staff. Congratulations to Lake Forest and Whiteford for receiving 100% completion. Other high performers include San Fernando, Rice, Washington Middle School, St. Francis, Milwaukee, Turner, and JFK. One health educator even administered her survey in another school not participating in Hallways to Health as well. So some of the lessons learned and some of the approaches that were taken to administer the school employee needs assessment. In the top quote, you can see the site is good to go. Information was presented to the school principal, teachers were provided with the survey link, and were asked to take their tablets to the faculty meeting where they completed the survey. So we got the admin buy-in and use of technology and use of faculty meetings. Second, we informed the vice principal about our survey and expectations. Flyers were placed inside all staff boxes, and staff members were emailed a total of 3 or 4 times over 3 or 4 weeks. The vice principal made 2 intercom announcements asking staff members to take the survey. We had our raffle this past Friday because it was the last day before school started winter break. Again, we had the administrative buy-in. We have a multi-mode of administering the survey and advertising and increasing awareness of the survey. Next, a site that's well on its way to completing 50% of the needs assessment, 50% of the population completing the needs assessment. I implemented or integrated the staff survey with other staff wellness activities I planned during a grading day, something that this site had already been doing last year, and building upon those efforts. I provided an incentive or prize of coffee gift certificates for all staff to fill out the survey and administered the survey in 3 ways: email, printed, and handed them out during a presentation about staff benefits, and then in person. I walked around from class to class, had a conversation with staff while they filled out the survey. Again, there's some buy-in and there's some creativity about individual approaches as well as group approaches. And lastly, a site that is still making some adjustments and has a really great plan to get 50% of the school employees to fill out the needs assessment. We've decided to modify the questionnaire a little bit, just change the form of the questions to make them seem that they are more from the administration as opposed to an outside body to show support, and then send them out in the new year when people are more health conscious. So again, we need to have the needs assessment completed before we were able to begin our action planning. So how do we achieve school employee wellness? As Erin mentioned, in phase 2, we will focus on sustainable changes that improve the school environment while building a culture of health and making healthy choices the easier choices. You've already been doing a fabulous job in this work, and this phase will focus on scaling up and making these sustainable changes for your site. How do we get there, you might ask? What are the incremental steps and underlying drivers which will help us achieve our health objectives? For an individual, if you start at the bottom circle, we can influence things such as knowledge, attitude, and behavior. But as many of you know, changing individual behavior is not an easy task by itself with no other considerations. Individuals often are influenced by their interpersonal environment, their family, their peers, their social norms, and the associations which they belong to. Those, in turn, are influenced by the community landscape, the social networks, norms, and social standards. And those are influenced by the institutions, which have certain rules and regulations, policies and informal structures. And then there are larger structures, policies and systems, such as local agencies, local policies, state policies, federal policies, and laws and regulations that support or inhibit healthy actions and behaviors. This is called the social ecological model, and it shows the interdependent relationship between individuals and the systems in which they live and work. So when we think about changing school employee wellness and think about changing the culture of health, we're talking about the the top, the yellow bubble, and the green bubble, changing the structures, policies, systems, and institutions so that the community and interpersonal and individual are supported and sustained. One way we might do this, for instance, is by addressing access to healthy food. This may result in changing the culture by creating a supportive environment which addresses interpersonal changes in community norms of buy-in from the school administration at the institution and local level. As you can see, this is a trickle-down effect. Much of the exposure you have been given to this work has allowed you to build these crucial relationships with the folks who are able to set these policies at the institution and local level. The work you did in Phase 1 has helped to establish these relationships, and your continued participation in wellness committees and interactions with school staff and administration will provide a necessary foundation to begin and expand school and district wellness policies, as well as the ability to change the culture of health in your schools overall. The purpose of the needs assessment is to provide information to drive the action planning for school employee wellness with data specific to your site and recommendations as well. The needs assessment will help you understand your staff and their needs and will help identify the specific objectives and approaches that you might take. It is important, as we have mentioned numerous times, to continue to share this information with your wellness councils as well as other members of your school administration. This will promote continued support as well as help to ensure that your planning and your activities are executed as intended.
Thanks, Jordana. I'm going to briefly walk through how to export and look at your data in Survey Gizmo. Then I'll walk through how to use the information and what each of the questions is showing in terms of looking at school employee wellness to help identify some aims and drivers. I'm sure you're all familiar with Survey Gizmo by now, but as a reminder, here is the website, username, and login information. I'm going to do a live demo and use St. Francis as an example. Here you can see that we'll use the Results tab primarily and look at the Overview, Explore, Reports, and Exports. So this is what Survey Gizmo looks when you first log in. So as I mentioned, I'm going to use St. Francis as an example. So you might be familiar with this Build tab, but here we're going to go to the Results section. First, I'll click on the Overview option. This gives you some basic information such as the average completion time, whether more users did the survey on their desktop or a mobile device. So you can see that at St. Francis, the average time is a little bit longer than at some of our other schools. Next, you can go to the Explorer tab. This will let you navigate through the responses to each individual question and shows a chart to visually display the information. So here I could click on this next question and scroll through all of the results, and it will show me the proportions on these pie charts and the bar charts. You might not need to go through all of the individual responses, but if you'd like, you can do that from here. And you can download PDFs of all of the individual responses or look at them in other ways. And I'm happy to provide additional TA on that if you're interested. The Reports option will probably be the most useful for you. You can use a variety of different options, but this will be a great way to see your data through the summary report. Here we see a pop-up, and you'll want to include the open text and write-in, since there were a few options for people to do that. And then you'll hit Run. Here it automatically includes all of the questions that we had in our survey, and then we'll just hit save. It'll take a minute while it's preparing the report. And then if you want to, you could get a PDF, which is one of the easiest ways to look at it. And you have options not to put any breaks between the different questions or bar charts and tables. You can also include the page numbers. So I'm going to go ahead and download this report so that we can look at it together. And while that's downloading, I'll also mention that there is an option to export your data to Excel. And one benefit of this might be if you wanted to further assess questions to see responses across different individuals. That's probably on an as-needed basis, so again, I'm happy to help with that if there are questions. But to do that, you would go down to the Exports tab. And then you would have the option to export things to Excel and CSV. I'm going to go ahead and open the report that we just generated for St. Francis. And I'm just going to briefly hop back to our slides so we can see what we're going to cover in this section. So now I'm going to focus on how you might interpret your needs assessment information. As a reminder, our needs assessment had two key aims. The first was to assess the school's physical infrastructure and policies, and the second was to assess employee interest and participation. The goal of the survey was to reach all school employees, including teachers, administrators, and other support staff. You can look at the survey respondents to see if you were able to capture a variety of school employee perspectives. There were 22 questions in the needs assessment that covered a range of topics related to physical infrastructure and policies in your school to support healthy eating, active living, and social and emotional well-being. So we'll look at the different content areas, planning questions, and the supportive environment questions as we look through this example for St. Francis. Okay, so we can see that on the first page here, it gives you information about the job title of all of the different survey respondents. So here we can see that they were able to get a good cross-section of all of the different school employees. So there's some administrators, athletic team members, teachers, other faculty, receptionists, cafeteria workers, janitors, and others. So that's exciting that they were able to get a good cross-section of school employees. So you'll see that you're able to just scroll through all of the different questions, and it will show you a chart for all of the responses that have quantitative information, and it'll show you the percentages in each of the different categories in a table as well. So we can see that question 2 looked at the physical infrastructure and policies to support healthy eating. The results here show that many employees are already aware of guidelines that are posted in the school, but there might be some room for improvement to increase visibility and awareness. So question 3 also assesses physical infrastructure and policies around healthy eating. We can see here that there's less availability in the break room during staff meetings and at staff celebrations. So those might be potential areas for you to work in phase 2. For question 4, most employees agree that there are healthy meal options available in the school. However, some are unaware that any are available, so increasing awareness around these options could be useful in phase 2. This question assesses physical infrastructure and finds that there are already supportive of bringing food from home in the school. There's a very small proportion that don't know whether or not a refrigerator is available, so you might try to have some reminder campaigns about bringing food as a good option for our school employees. From this question, we see that healthy food at celebrations might already be available in the school. So increasing awareness and ensuring that there are healthy options at every celebration might be a potential approach to focus on in phase 2. Here, question 7 assesses employee interest in purchasing heart-healthy snacks if they were available. About 70% of school employees indicate an interest in healthy snacks. This could help be a driver to show school administrators that there is support for changes to policies and infrastructure for healthy snack options at the school. If there was little support for healthy snacks, you might have to start with some basic health education about healthy snack options and raise awareness about their availability in the school. Question 8 assesses school infrastructure and whether there is already a water cooler station and employee interest in using it. Here, there's conflicting information, so you should first perhaps do an observation of the school to see if water coolers are available. Maybe they're only in certain areas of the school and maybe few employees know about them. So you might do some awareness raising or try adding an additional station if there was interest in that. This question assesses employee interest to help with planning purposes. The majority are most interested in a weight loss challenge, followed by developing a personal nutrition plan, a weight management course, and healthy cooking classes. Keep in mind that people might be optimistic when completing the survey, and we know from sites in phase 1 that the actual participation numbers when implementing some of these approaches might be somewhat lower due to competing time demands. So don't be discouraged if not all of these people show up to some of the approaches that you actually implement. Question 10 assesses school infrastructure and policies around whether stairs are well-lit, safe, and accessible to employees. And we see here that most employees, about 90%, know they can use the stairs, but some do not. If you found a smaller proportion were aware of this in another school, you might do some awareness raising, such as posting flyers about the health benefits of taking the stairs. If you work in a school that has stairwells, but they're not accessible to employees, you might work with administrators to see whether they could gain access so that they could take the stairs instead. This question assesses physical infrastructure to support biking to work. Here again, we see some conflicting information since about 80% say there's not bike racks, but a few say that there are. You might want to walk around the school and observe whether there are bike racks or not before proceeding. If there are, a reminder and awareness campaign about them might help promote people biking to work. If there aren't bike racks and you know that there's interest, you could ask people whether or not they would be willing to bike to work and get some additional administrator buy-in to see whether or not bike racks could be added as a potential systems change. You might then have bike to work days to regularly encourage people to come to bike on their way to school. So question 12 assesses whether the environment is supportive of physical activity breaks. Here it looks like most school employees disagree. So this could be an important driver of a policy or systems change that might be addressed through Hallways to Health. Physical activity depends on access and a place to do it, as well as administrator support and employee interest. This question looks at employee interest and drivers for participating. Mobilizing a group might be a strong incentive, as 77% said they would join and participate if there were a group. We know from some of the earlier responses that there was support for a weight loss challenge. Group and social support in this school should be considered for designing approaches. Keep in mind that 10% strongly disagree and might prefer to work out alone. A place to do it is also important, as about 65% indicated. You can find out more from the open text responses at the end, but in conjunction with this, you might identify whether there are any free times or spaces designated for employee exercise. This question further assesses employee interest in specific fitness activities. There appears to be an even distribution. You could further explore individual results to see if the same people said yes across all of these different options, or if different respondents had different interests. Group activities were a big draw on previous questions, so they might be a good starting point here in addition to some potential individual options. Question 15 assesses physical infrastructure and policies. We see that most school employees say that there is a break room available in good condition, but not all agree. You might supplement this information by going to look at it in person or asking a few individuals for further feedback. Does it need to be painted? Does it need more chairs? Is it not really available for all school employees? Some of the Kaiser resources might help you to ensure that a break room is available in good condition. Assessing interest for participation in stress busters during high-intensity times can help indicate potential employee involvement in things like yoga, mindfulness, massages, and more that you may know about from Phase 1 or other survey questions. You will need to identify high times of stress for employees at your school to best target approaches to that environment. For question 17, employees indicate particular interest in yoga, meditation, and stress management, but fewer did so for mindfulness. Some people might not know what mindfulness is, so keep that in mind as you use this information for planning purposes. You could use this information in combination with questions 15 and 16 to help plan approaches for social and emotional health. Do you have space and instructors for these approaches? Think about what their frequency might be. From question 18, you can use this information to plan approaches and be sure to have a combination of times as an option, and be aware that planning time is highly valued for faculty members, so you might want to, as I mentioned, use a variety of different options, even though here you can see some clear times that are of particular interest. Question 19 looks at the best ways to distribute health information in the school to employees. Here, the overwhelming majority prefer to receive information via email. So this might help you target education and awareness-raising campaigns and use email as a priority means of communication. Question 20 looks at whether or not senior leadership helps support healthy lifestyles. Here we see that many agree that they do, but there is room for improvement. You might work to address this environmental issue by working with administrators at both the school and district level. So the last two questions are open-ended, so you can look at them for any further feedback from the school employees. Here, there's some valuable information about resources gathered to help employees find gyms near school, for example, and sending out health promotion emails are both of interest. And then in question 22, excuse me, we see that there is support for access to a place to exercise for employees. This, combined with the information about group fitness and availability of a place, suggests a potential area for systems change action, working with administrators to get a place for fitness for school employees. Now that we've reviewed how to analyze each question and think about their implications for approaches, Jordana is going to move into the next section about setting some objectives.
Thank you so much, Erin. Give me 1 minute as I switch back to the PowerPoint presentation. Okay. Erin presented a really comprehensive dive into how to use the needs assessment to determine what possible approaches might be. But we have to think about our ultimate goal and objective for this initiative and where those approaches fall. Ultimately, as we talked about in the social ecological model, we're trying to make changes in health. You may be measuring this you may be measuring health changes at your school-based health center, or this may be a longer-term impact of the work you are doing. All of the health objectives are our ultimate goal in doing this work. We want to improve healthy eating, active living for school employees, and social emotional health as well. When we're going to think about what we want to achieve, we want to think about setting objectives which are SMART. SMART objectives are specific. They detail exactly what needs to be done. They're measurable. The achievement or progress can be measured. They're achievable. The objective is accepted by those responsible for those achieving it. They're realistic. The objective is possible to obtain. And they are timely. The time period for the achievements is clearly stated. So for instance, if we were going to set some health objectives or longer-term objectives for our school employee wellness work, these might be some examples. By June 2017, a date, decrease average blood pressure among school employees at Roosevelt High School by 15%. It's specific, measurable, achievable, realistic, and timely. We may also want to focus on the social emotional piece. So by June 2017, there will be a 15% decrease in self-reported stress or perception of stress among school employees at Roosevelt High School. How do we get there, you might ask? What are the incremental steps and underlying drivers which will help us achieve our health objectives? As we discussed previously, we have to change some factors in the individual knowledge, attitudes, and behavior. And then we need to make this change sustainable by addressing access and culture, such as support. We will make policy changes that address the physical environment and provide written support. As you will remember, we have already set broad policy objectives for the initiative. By June 2017, 100% of the sites will institute at least one school-wide policy change in the area of school employee wellness. One will focus on healthy eating, and the other will focus on social emotional health. As we think about objective setting and how we are going to get there, we need a tool to provide us with a plan of how to get there. This tool will be called the action plan. The action plan will help you use the needs assessment, which we just went through, to think about how to achieve your health objectives. It asks you to think through your aims, the underlying drivers, and brainstorm possible approaches, as well as ask you to measure the impact. As you see, the action plan template starts with asking you to identify your healthy eating, active living aims. These should be SMART, as just like the slide we discussed before, and the social emotional aims as well. Then the action plan will ask you to go through the needs assessment and think about your aims. What is the overall thing you want to change or achieve? Eating, physical activity, stress management, and it will ask you to identify the drivers. What is your focus area for each of those? Is it accessibility, education, awareness, attitude, social support, time, cost, social norms, or physical environment? Next, it will ask you to go through and identify the possible approaches. How will we get there? There being, how will we get to satisfying our aims? And measure. How can we measure that the effect or the impact of the approach? Going through the action plan will require an in-depth look at the needs assessment in order to help identify the aims, drivers, and possible approaches. Okay. The next section in the action plan document looks like this. Use this worksheet to help you meet your health aims by describing what solutions could look like in your school. The worksheet asks you to identify the components which drive your aims, selecting approaches to test, and determining how to measure the impact. So we already discussed some of the possible drivers: accessibility, education, access, support, buy-in, physical environment. Next, we would move to thinking about the approaches column. What are possible approaches you might take? You might think about approaches that focus on behaviors: healthy eating, water consumption, activity levels, time management, work-life balance, sleep. You might think about skills that could be learned through your activities: coping, decoding nutrition labels, understanding portion size, making healthy decisions, understanding the role of essential vitamins and minerals. Or you might choose approaches which are meant to change individual attitudes or social norms in your school. These may address passion or commitment to school, motivation or interest, and other factors. So this is kind of where it comes to you and your creativity about what you've been doing in the past, what your needs assessment shows you, and using some innovative approaches to drive a change of health in your school. The next section asks you to answer questions to assess the overall impact and predict long-term successes. Many approaches could be taken to help achieve your healthy eating, active living, and social emotional health aims. Use these questions below as a guide to plan for each of these approaches. Based on these answers, choose the methods which are most relevant and achievable for your school. Approaches should be selected if knowledge is low, interest or attitude is high, and it is feasible to change behavior, and there is a possibility of sustaining the change. Again, any activity, program, or education that is selected should be a step in the process to creating sustainable change and policy change. This may mean adapting some of the approaches you took in phase 1. The template does not ask for answers to all of these questions, but asks you to think through each one. Reach. How many school employees will be affected? Who is our target audience? And how will we track that we have reached them? Interest. How do we know this is something our school wants to do? Resources and infrastructure. What is needed to get it going? What resources do we have? Is it a feasible project? Sustainability. How will we sustain the program? How will this event or program contribute to changing the culture and accomplishing our aim? Impact. What impact will this have on the health of our school? What impact will it have on our culture of well-being? How will we track it? Support and stakeholders. Whose support is needed? How can we get it? What is the likelihood of their support? Barriers. What obstacles might exist to our approach? How can we overcome them? Fun. You have to choose an approach that will be fun for your staff and for the rest of the school to participate in. And time. How quickly can we get it started, and how much time will it take? Again, this question is just to reiterate the importance of thinking and considering who needs to approve, who you will enlist to help you, and who you are trying to reach in your efforts. As engaging all of these different stakeholders through this process will be crucial to having a successful school employee wellness initiative. Lastly, once you've gone through all of these questions, you've identified your aims, possible drivers, possible approaches and measures, and identified the questions and answered the questions about fun, sustainability, stakeholders. It's now time to get down to the work. So once you've selected an approach that sounds feasible for your site, use this section of the action plan to denote what steps need to be taken, by whom, when they need to be done, and any other considerations. This is a little bit similar to the PDSA cycles you guys used in phase 1 and breaks it down into really concrete steps. So thinking a little bit about what we just heard about the evaluation from the needs assessment from St. Francis. I know that this slide has a lot of text, but I'll just talk through it quickly. In the needs assessment that we looked at, we learned that Healthy eating guidelines were posted in the school, but visibility and awareness were low. Healthy snacks were available, but access and awareness should be increased for food in the cafeteria and staff meetings and staff celebrations. Awareness was low that cafeteria meals were available and affordable for the staff. We also learned that interest for healthy snacks was limited, and it creates an opportunity for education to think about the link between heart-healthy food and long-term health. So one driver that we might address is increasing consumption of vegetables and decreasing the BMI, body mass index, for school employees as a long-term health aim. The driver to this might be access to healthy foods in the cafeteria. A possible approach might be including a salad bar for staff and advertising it in the weekly staff email about the healthy options to increase awareness, as well as working with food services to allow lunch at discounted rates for staff by ensuring that the food is available and affordable. It promotes healthy eating, and when some staff see that other staff are eating healthily in the cafeteria, they will be encouraged to do the same. So a measure could be an average number of staff eating in the cafeteria per week. Likewise, we might want to, for social emotional health, decrease stress response and increase the ability to manage stress by school employees. And then our driver might be the supportive environment and administrative support. So one of our possible approaches might be protect staff planning time and break time, as Erin mentioned was important to do before, and guarantee that the work and break and workspace are a healthy environment. As Erin mentioned, there was mixed results about the employees at St. Francis assessing whether the break room was a relaxing and conducive place to do work. So this might be something that your school wants to tackle. Another thing you might want to do is commit to hosting yoga or meditation regularly during a high-stress time. Some of the measures you might use are self-reported stress levels by teachers during high-stress time and average participation in yoga classes throughout the semester. So in conjunction with the School Employee Wellness Initiatives and creative, innovative approaches that you took in Phase 1, we have developed a resource to share with you on approaches to be used in the second phase of School Employee Wellness for Hallways to Health. So we will be sharing this resource with you. It has some best practices both from your organizations, as I said before, as well as product of various different school employee wellness trainings from Kaiser Permanente, as well as other available resources that are out there. So as you can see, the document is broken into overall wellness approaches that span both physical activity, healthy eating, active living, and social emotional health. So you can see some of those are school employee wellness policies are written, enacted, and upheld, conducting annual presentations to school staff on health benefits and services, building formal partnerships between administration, staff, and the community. Okay, and within each of these approaches, there is also an explanation of the connection between the approach and the impact it has on changing the culture of health in the school. Some of the healthy eating, active living approaches include ensuring healthy options are available in the school cafeteria and providing use of school gym or other designated spaces for group and individual fitness classes on a regular basis. And some of the social and emotional health approaches are prioritizing staff appreciation, institutionalizing regular opportunities for staff appreciation, committing to social and emotional health events regularly, and including training on skills to improve social and emotional health. We will be posting a resource guide for school employee wellness. This guide will have plans, examples of health promotion plans and school wellness policies, as well as objectives. It will also include some links to articles about policy change for school employee wellness, as well as provide some other toolkits that are specific to things like healthy eating, healthy meetings, and celebrations. Please use these resources to assist you in your brainstorming and your planning. And we will be asking you to do some reporting on your action planning, and the reporting will cover the following topics related to the school employee needs assessment. It'll include topics on building buy-in and support from your administration, administration and implementation of this needs assessment, how you will use this information, as well as technical assistance required.
Thanks, Jordana. So just a few next steps to help answer questions that you might have. Jordana and I will again be available for office hours. These will be live sessions through GoToMeeting like we did last time. The first will be on January 7th from 3:30 to 4:30 p.m. Eastern Time. Again, office hours are optional, but we encourage you to take advantage if you need any input or have questions along the way. We encourage you to get started on your analysis and action planning. We'll be posting the link and a PDF of the action plan template, as well as the approaches document and the presentation today on Basecamp, as well as emailing them to everyone. We will, of course, be available for questions and one-on-one TA as needed for the needs assessment analysis, priority setting, and action planning. You might work with your state affiliates to determine when they want drafts of your action plans to them and whether they would like to add or address any details. As a reminder, the action plans for employee wellness will be due on January 29th, and the quarterly report will be due January 15th with your second invoice. So again, kudos for all of your hard work thus far to implement the employee wellness needs assessment. We're thrilled with the participation that you all have gotten at your schools, and are confident that the next steps will allow you to build even stronger relationships with your school administrators and employees, and upon your successful approaches from phase 1, and help infuse them into the school for the long term. We're always available for questions and comments, and thank you for all your hard work.
Thank you so much.